Welcome back. We are at chapter 24, Infectious Diseases and Sepsis. Topics we are going to discuss in this chapter are going to be infectious diseases, sepsis, and selected common communicable diseases. In this first section, we're going to talk about infectious diseases. How diseases spread. So first, infectious diseases, bacteria, viruses, and other microbes. Where communicable diseases are direct contact and contact with secretions. So remember that an infectious disease is caused by bacteria, viruses, and other microbes and may not be communicable. So when an infection does cause illness, the time from the exposure to development of the first symptoms is called the incubation period. So the interval when the patient is shedding or releasing the infectious material, that's when it's the communicable period. So when the microbe, and that's when the microbe can actually be potentially transmitted. So remember that every infectious disease has an incubation period, and every communicable disease has a communicable period. Factors causing infection and illness after exposures are virulence, dose, route, and body's resistance. In this section, we're going to talk about sepsis. Okay, we're going to start out with the pathophysiology. So sepsis is a life-threatening condition resulting from an abnormal or counterproductive response by the body that causes damage to tissues and organs. So that's when the body overreacts and secretes substances that instead of helping actually hurt cells, tissues, and organs. So septic shock occurs when these changes result in shock and hypotension that do not respond to intravenous fluids. So remember that sepsis involves abnormal and counterproductive response by the body that damages tissues and organs, and it can progress to septic shock. Okay, so the infection, which is local, is where the microbes multiply. The body mounts a normal immune response and usually an increase in the white blood cells. So sepsis is systemic. So the body produces lactic acid and other chemicals, and it's the ability to produce white blood cells that may be limited or exhausted. Then septic shock, which is the systemic and it's with hypotension, is when the lactic and other chemicals accumulate in that bloodstream, causing the vasodilation and increased capillary permeabilities or the leaky capillaries. And this then leads to the hypotension. So remember, when they're in shock, the blood pressure decreases, pulse increases, respiratory increases. That's when you know you're in that shock process. So let's talk about some common causes. So locations of the body likely to be associated with sepsis is going to be the lungs. So if they happen to have pneumonia. In the gastrointestinal tract, any abdominal surgeries or pancreatitis. In the genitourinary tract, could be kidneys or prostate infection or the urinary catheter. With the skin, any long-term intravenous catheter, tracheostomy, gastrostomy tube, and pressure sores. So much about sepsis is still very unknown. So the exact pathway for the development of sepsis is actually unclear. Many cases don't actually have a clear defined source, and the definition is still changing. So the treatment is still improving. So they don't know why. So it's very unknown at this point. All right, so patient assessment. How are you going to do this? So systemic inflammatory response syndrome, or the SIRS, has a criteria. So the temperature is lower than 96.8 degrees Fahrenheit. It's higher than 101 degrees Fahrenheit. Their heart rate's going to be over 90. Their respiratory rate's going to be over 20. Their systolic blood pressure is lower than 90. And they'll have a new onset of altered mental status or worsened mental status. So with that, the SIRS criteria are very, very vague. So, I mean, it's just vague. Can't really explain much about it. But many patients without sepsis will have 2 or more abnormal findings. So in the case of trauma patients, okay? So a number of patients with sepsis will not have 2 or more abnormal findings. So you're just never sure when that patient is actually in sepsis or when they're not. But that lower blood pressure, higher heart rate, higher respiratory rate, a new onset of altered mental status or worsened, that's going to be a very good indication. Then you have your quick sepsis-related organ failure assessment, or your QSOFA. So it resembles the SIRS criteria, but it does not predict whether someone is septic. It predicts whether septic patient will have longer to stay in an ICU or be more likely to die. So really, I can't emphasize it enough that you have to follow your local protocols and own clinical judgment when determining whether this patient may be septic or not. So for patient care, you're going to look for signs of sepsis in an infected patient. You're going to provide supportive care, and if the patient meets SIRS or simple criteria, inform the ED of a sepsis alert. In this next section, we're going to talk about the selected common communicable diseases. All right, so patient assessment and care for the selected common communicable diseases. First thing you're going to ask is prevention. Okay, what about prevention? Did they have the appropriate vaccinations and did they use standard precautions? Furthermore, did you have your appropriate vaccinations and use standard precautions when you were caring for this patient? During your assessment, you're going to ask the patient, have you traveled anywhere? And if so, has that patient received the recommended vaccinations for that area of the country that they were traveling? So first and foremost, you want to protect yourself and the patients from infectious diseases by getting your appropriate vaccinations and using standard precautions on every single call. So when you encounter a patient with a fever or vague symptoms or an ill-defined complaint, you want to ask them where have they traveled in the previous several weeks and did they receive the recommended vaccinations for going there? As far as care, you want to understand how that patient feels, wear personal protective equipment, and get further testing and or receive preventative and prophylactic antibiotics. All right, so chickenpox. It's caused by varicella zoster virus, which is VZV. Signs and symptoms are going to start with very vague symptoms resembling a cold, followed by fever and a rash that itches and looks like blisters. It's very contagious. It's direct person-to-person contact, airborne from rash on the skin or mucous membranes, and dried scabs do not spread the disease. Chickenpox can spread from 1 to 2 days after the lesions appear until they dry. So it's a long period that they could potentially be infectious. So here's a child with chickenpox. So it's just got a bunch of little dots all over them. So treatment and prevention of chickenpox is to isolate the patient until the lesions are dry. Antiviral medications to shorten course of disease and prevent any complications, and then of course getting the vaccination to chickenpox. You want to receive vaccine within 3 days of the exposure. So chickenpox is traditionally a childhood disease, but it can return in adults in a different form called shingles. So when it reactivates later in life, this is often in response to stress. So the rash persists for 7 to 10 days and heals within about a month. But a small, significant number of patients experience the post-therapeutic neuralgia. Next is measles, also called rubeola. It's a highly infectious viral disease. Signs and symptoms can start with a fever, cough, and eye irritation. They'll have small white or bluish white spots on the inside of their cheek, called Koplik spots, or a red blotchy rash. So measles is a very highly infectious disease that can spread and requires standard precautions. So always, again, making sure you have your standard precautions on. Here is what the measles rash is going to look like. Measles is easily spread. So it can go by inhaled droplets in the air or contact with nose and throat secretions. There's no specific treatment. Prevention is vaccination, quarantine, and hand hygiene. So patients at risk are infants less than a year old, pregnant women, and immunocompromised individuals. They may receive the immune globulin for protection. Measles is a reportable disease, and increasing numbers of outbreaks have occurred in the recent years among those unvaccinated patients. So what you want to do is you want to contact that receiving facility to ensure that they can handle the patient properly before you transport them there. Next one is mumps caused by the paramyxovirus. Signs and symptoms start with vague symptoms such as muscle aches, loss of appetite, and headache. It progresses to swelling and inflammation of one or both parotids. Parotitis lasts 7 to 10 days. So the incubation period for mumps is 16 to 18 days. But patients are most infectious from day 2 before the parotid swells and appears 5 days after. So you do have a 7-day period, but 2 days before you even see any swelling in that parotid. So here is mumps showing the characteristics of that parotid gland swelling. So the parotid glands, if you look back by the ears, you can see that swelling in there. That's that parotid gland. Mumps are transmitted through droplets or direct contact with saliva. Prevention is going to be your vaccinations and then quarantine of the patient for 5 days after the swelling appears. So the treatment of mumps is supportive with no specific post-exposure action. But approximately a quarter of adult males who get mumps also gets orchitis. And it has resulted in a very few cases, but it has resulted for where men become sterile, so not being able to have kids. Next is hepatitis A. Hepatitis is a general term that means inflammation of the liver. Signs and symptoms are going to be fever, nausea, loss of appetite, malaise, abdominal pain, jaundice, possibly a few days later, and generally worse in older patients. So hepatitis A is one of several types of hepatitis, and it starts suddenly in adults. Here is an example of what jaundice looks like from a hepatitis A patient. So if you have yellowing of the skin or of the eye, that means you have inflammation in that liver. Hepatitis A is spread by fecal-oral route. There's no specific treatment, and prevention is hand hygiene, proper food preparation, and vaccination. Treatment of hepatitis A is supportive. So post-exposure actions involve vaccination and in some cases, immune globulin. Hepatitis A may spread easily when people crowd together, especially under unplanned circumstances. Hepatitis E, however, is spread by the same route but caused by a different virus. It is much more common outside of the United States and Europe. Next is hepatitis B. It is an infection with the hepatitis B virus, or HBV, which is very common in many parts of the world. Signs and symptoms are going to be your nausea, vomiting, loss of appetite, vague abdominal pain, progresses to jaundice, and younger patients have fewer or no symptoms, but much more likely to develop a chronic infection. So hepatitis B is very different from hepatitis A. It is more serious disease with sometimes even life-threatening consequences. So before the development of a vaccine and changes in injection practices, hundreds of healthcare workers, including EMS, died every year in the United States from occupational acquired hepatitis B. So if you do ever get stuck with a needle or anything like that, you always want to be checked at your local emergency room and write up an incident report and so forth. And if you are going to work in the world of EMS, I highly recommend getting your hepatitis B vaccination. It's just going to protect you. So hepatitis B is transmitted by blood and any fluid that contains blood, semen, cerebrospinal fluid, amniotic fluid, vaginal secretions, and a few other fluids. So the routes of transmission for hepatitis B include blood transfusion, shared needles during drug injections, sexual intercourse, close household contacts, the reuse of lancets for glucose testing, and childbirth with the mother and the neonate. So HBV is very hardy and can survive for a week on surfaces outside of the body. So it is very, very, very transmittable. With hepatitis B, there is no specific treatment. Prevention is going to be your vaccinations and proper decontamination of equipment after a call. And I cannot stress this enough, how important it is to clean your equipment after every single call. That is down to the blood pressure cuff, the blood pressure hose, the cot, the sheets, everything. Anything that you touched when you were working with that patient should be disinfected before you touch another patient with it, or work with that equipment and then go and touch another patient. It's extremely important to decontaminate equipment. Post-exposure actions are wash the exposure site with soap and water. See your healthcare provider right away. Don't wait to go to the clinic. You need to go to the emergency room, or if they can get you in the clinic right away, go for it. Your vaccination, and then the possible immune globulin injection. So the treatment of hepatitis B is supportive. So the safety and effectiveness of an antiviral medication administered in some countries is very unclear. Hepatitis D can only occur in patients who have the HBV infection. It has similar signs and symptoms, but it is more sudden in onset and has a shorter incubation of 2 to 8 weeks. So there's no vaccination yet for hepatitis D, but if you are have your immunizations against hepatitis B, you cannot be infected with hepatitis D. So there is a treatment, but it is administered over the course of almost a year. So just be on the lookout for that, or be conscious of that. Next is hepatitis C. So hepatitis C is very similar to hepatitis B in many ways. So signs and symptoms are going to be nausea, vomiting, loss of appetite, and vague abdominal pain. So even though hepatitis C is pretty similar to hepatitis B in a lot of ways, jaundice is less common in the hepatitis C. And more patients, typically about 3/4 of them, are infected without showing any symptoms at all. So this is why it is, again, very important that you are using your standard precautions on every single call, because you don't know who you're going to come in contact with, and you sure the heck don't know if they have hepatitis C or B or A or D, because they might not even know that they have it. So again, this is why it is extremely important to always have your PPE on, or your standard precautions. So hepatitis C transmission is through bloodborne through shared needles. It's less common through sexual intercourse or childbirth. There's several safe medication regimens, but no vaccine at this time. And prevention is standard precautions and proper use and disposal of sharps. So a thing to think about is hepatitis C may be communicable forever in those with a chronic infection. So the precautions for the hep C are the same as for any other exposure, but there is no specific treatment to prevent or reduce the risk of developing the disease. Hepatitis C can linger in the body for decades before producing cirrhosis or liver cancer. So safe and effective treatments prevent these conditions from actually occurring. Next, we'll talk about HIV and AIDS. Signs and symptoms. So for some patients, they'll have flu-like symptoms within the first few weeks of the HIV infection. They have a fever, sore throat, and fatigue. AIDS is characterized by the opportunistic infections, pneumocystis carinii, Kaposi's sarcoma, and tuberculosis. AIDS is still one of the few diseases for which people experience discrimination, but treatments that have reduced the level of infectivity have made tremendous differences in the length and quality of life for these patients. This is what Kaposi's sarcoma looks like. The routes of transmission for HIV and AIDS is shared needles, unprotected sex between men, any penetrative activity involving blood and semen, and during delivery or breastfeeding from one mother to the newborn child. So for HIV and AIDS, there is antiviral medication that reduces and suppresses the HIV viral load. The prevention is standard precautions and public measures to reduce shared needle use and promote condom use. Following significant exposure to blood or other body fluids, you want to wash the area and consult a healthcare provider. People panic about HIV, which still persists in some areas. To help reduce the fear of HIV and AIDS, you may explain simple precautions to prevent HIV infection and treat all patients with respect and courtesy. Next, we'll talk about influenza, which is a common viral illness. Signs and symptoms are fever, non-productive cough, severe muscle aches, sore throat, headache, and severe weakness. Influenza is a common viral illness that tends to occur at certain times of the year, but can occur at any time. It is caused by more than 24 viruses. Here is a child with influenza showing signs of a fever. So as you can see, when you're checking a child's fever, if you don't have a thermometer on you right at the time, you can take off the part of your glove and use the back of your hand to see how warm that child is, like this guy is doing here in the picture. Influenza is spread by droplets or direct contact. The antiviral medications lessen the severity and shorten, but must be taken within 48 hours of the symptom onset. Prevention of influenza is going to be hand hygiene, surgical masks, and vaccinations. Antiviral medications can be taken post-exposure. So when the CDC identifies a new strain of influenza, it is recommended that healthcare providers take respiratory precautions, including N95 masks, until the droplets precautions are confirmed to be sufficient. So to date, standard surgical masks are sufficient for all forms of influenza. So the population is more prone to influenza are very young people, the elderly, and patients with chronic conditions. The next one we're going to talk about is croup. It is also known as the laryngotracheal bronchitis, which is caused by human parainfluenza virus, which is the HPIV. Signs and symptoms are going to be inflammation and swelling of the larynx, trachea, and bronchi. Happens in children between 6 months and 3 years of age. They're most susceptible and present with a history of upper respiratory infection that later produces characteristics of a seal bark cough. So if you've ever heard a seal bark, that's kind of apparently the sound they're going for. So symptoms often worsen at night. So despite that resemblance of their names, parainfluenza and influenza, they are completely separate organisms and cause different signs and symptoms. So again, going back to your signs and symptoms are going to help you determine what disease or infection you may have. Croup is transmitted by droplets from coughs or sneezes that survive on objects. You want to assess the child as for any patient with shortness of breath. Prevention is going to be your hand hygiene and refrain from touching your nose, eyes, and your mouth. Treatment for croup is symptomatic. There is actually no vaccine for it. So some people will tell you with kids with croup and coughing like they are, especially in the cold, if you live in a cold climate, taking the child outside and letting that cold air get into their lungs. It'll help with that croup. So the next one we're going to talk about is pertussis, or also known as whooping cough. So it is a respiratory infection caused by the Bordetella pertussis bacteria. Signs and symptoms are going to be that they begin like a typical upper respiratory infection and worsens into fits of uninterrupted coughing, followed by a whooping sound on inspiration. Pertussis is spread by large droplets in the air. They do have treatment with antibiotics, and if you have a vaccine, you can prevent it with hand hygiene and refraining from touching your nose, eyes, and mouth. Post-exposure, antibiotics are considered for women in the last 3 weeks of pregnancy and infants younger than 1 year old. Vaccinations are also helpful in long term. There has been a major recurrence of pertussis, and it is fatal in infants. Prevention in adults is the best way to prevent the illness in the very young. Next, we're going to talk about pneumonia. Signs and symptoms are fever, chills, shortness of breath, tachypnea, pleuritic pain, productive cough, inflammation consolidated in part of the lung on the x-ray, potential febrile seizures in young children and infants, and altered mental status is a common sign in the elderly patients. On this chest x-ray, it is showing the inflammation of the lung. So what you want to do is you want to note that area in the lower right lung that appears to be cloudy. This part is where that pneumonia is located. So as you can see on the picture, it's a little bit cloudy or white in appearance. Pneumonia is spread by droplets but requires close contact for several days. They do have treatments with antibiotics, and the prevention is vaccination, hand hygiene, and cough etiquette, meaning you're coughing into your elbow or into your arm or into your clothing or whatever, so you're not coughing out to where everybody can get all your droplets all over them. Pneumonia does have many different causes, including viral. So it is a common cause of sepsis in patients at the extremes of age or with that compromised immune system. So don't forget that. Next is tuberculosis. It is caused by bacterium, Mycobacterium tuberculosis. Signs and symptoms are cough. They initially start out dry and then later productive of purulent sputum, fever, night sweats, and weight loss. Latent TB is common in people who are exposed and means that they have an infection, but they don't have any symptoms. Tuberculosis is spread by coughing, singing, or sneezing. Treatment with antibiotics and prevention with vaccines. So high index of suspicion and airborne disease precautions, including that N95 respirator. So the EMT must report exposure to a TB infected patient and follow your agency procedures and protocols for evaluation by a qualified healthcare provider. TB is more common in settings where people have poor health are gathered, so like a nursing home, for instance. So patients with HIV are at higher risk to get tuberculosis. Next one is meningitis. So it's the inflammation of the meninges, which are caused by bacterium Neisseria meningitis. So signs and symptoms are abrupt onset of fever, nausea, vomiting, severe headache, nuchal rigidity, photophobia, and possible petechiae. So meningitis is an inflammation of the meninges, which are the membranes that surround the brain and the spinal cord. There are a number of causes of this condition, but the section will focus on the meningococcal meningitis, which the meningitis has numerous potential complications, including shock, multiple organ failures, blood clotting problems, brain damage, could be deafness, and even loss of one or more limbs. Here is the petechial rash associated with meningitis. Meningitis is spread by direct contact. So treatment with antibiotics for meningococcal meningitis and prevention is by vaccination. Next, we're going to talk about sexually transmitted infections. So viral STIs are HIV, hepatitis A, B, and C, genital herpes, and human papilloma virus, or HPV. Bacterial STIs, or sexually transmitted diseases, infections, is chlamydia, gonorrhea, and syphilis. Prevention are condoms and vaccination. However, condoms do not prevent all sexually transmitted infections. STIs are not a common reason for patients to access 911 emergency services except for women who develop the pelvic inflammatory disease, also known as PID. Most commonly is caused by gonorrhea or chlamydia, and it causes severe lower abdominal pain that may or may not be associated with increased vaginal discharge. Next, we'll talk about diseases carried by ticks. So tick bites transmit Lyme disease. Most patients display a rash within a week that looks like a bullseye. You can treat with antibiotics, and prevention in backcountry rescue in wooded areas are to cover your arms and legs, check frequently for ticks, and remove ticks with tweezers. There are other diseases such as Rocky Mountain spotted fever, which are carried by ticks as well. But if you live or work in the area with ticks, consider becoming very familiar with which diseases are most common in your area. Next, we'll talk about the emerging and newly recognized infectious diseases. So in some cases, antibiotics that used to be effective no longer work. The result of bacteria developing resistance. The patients may get infections that are no longer treatable, and patients may die from diseases that were easily cured a few years ago. So you always want to use standard precautions to protect yourself, your coworkers, and other patients. So increasing bacterial resistance has led to several conditions that we deal with on a general daily basis, including the staph infection, also known as the MRSA, and the VRE, and the C. diff. And a less common but still important example is a multi-drug resistant tuberculosis. So as bacteria evolves, this list will eventually grow. So just be aware that it's always going to grow. So we also have had recent emerged ones or new discovered diseases also include the HIV and AIDS, the severe acute respiratory syndrome, also known as SARS, the Ebola virus disease, so the EVD, or the Middle East respiratory system, which is the MERS-CoV, and then the Zika virus. When the next outbreak occurs, like we just had COVID that went through not very long ago, you want to remain calm, understand that news reports may exaggerate the extent of the number of ill or the ease with which the disease is spread. You want to follow the recommendations of the CDC and your local health department. So when new infections have emerged, several common events occur. So the report of outbreaks lead to panic or near panic states. The CDC and the World Health Organizations and other national and international agencies work diligently to discover these microbes that cause the diseases and then effective treatment for them. So how to prevent their spread. The information gets disseminated to healthcare providers and institutes so that it can then be implemented. Healthcare workers implemented the appropriate steps and then significantly reduced the number of people who become infected or ill. So it's been several years since there's been a huge outbreak, and then all of a sudden COVID happens and the world shuts down, basically, right? So where was the information coming from? It was a quick, fast thing. Some people got vaccinated, some people didn't. Some people still believe in the vaccination, others do not believe in it at all. That, prior to this, several years, it took people to get a vaccination, and now all of a sudden, boom, COVID, and we have a vaccination in a short amount of time. Whether you are a vaccinator or a non-vaccinator, it doesn't really much matter. But this goes to show that it just can take one route of information from either agreeing with it or disagreeing with it that can go two totally different directions. So always just be sure that you're listening to the right information and you fully understand everything that is going on. All right, we are at the end of the chapter. Let's do a quick chapter review. Sepsis is a life-threatening condition resulting from an abnormal and counterproductive response by the body that causes damage to the tissues and organs. Septic shock occurs when these changes result in shock and hypotension that does not respond to intravenous fluids. Common sources of infections that lead to sepsis include pulmonary system, gastrointestinal system, genitourinary system, and central nervous system. The SIRS criteria are far from perfect, but may help in detecting sepsis. In a patient with an infection, either confirmed or suspected, you want to look for a temperature lower than 96.8 degrees Fahrenheit or higher than 101 degrees Fahrenheit. Their heart rate should be over 90, respirations greater than 20, and systolic blood pressure of less than 90 systolic. New onset of altered mental status or worsened mental status compared with normal. In the septic patient who does not need resuscitation, the most important thing you can do is to notify the receiving hospital of the sepsis alert. When evaluating a patient with a fever or other signs and symptoms suggestive of an infectious disease, ask the patient about recent travel. The most important and effective ways to avoid getting an infectious disease on an EMS call are to make sure you have appropriate vaccinations and use standard precautions. When new or newly rediscovered infectious disease outbreaks occur, follow the advice of the Centers for Disease Control and Prevention and your local health department. Remember to determine whether a patient potentially has sepsis using the SIRS criteria and alert the ED staff if you have an index of suspicion for sepsis. Know what personal protective equipment you need to wear to prevent infection from different infectious diseases. Questions to consider. What are the SIRS criteria? What body systems are most common sources of sepsis? And what is the difference between the incubation period and the period in which the disease is transmittable? So although patients with serious infections usually have a fever, some patients with sepsis are actually slightly hypothermic. So do not ignore the possibility of sepsis in the patients with a lower than normal temperature. Unfortunately, the SIRS criteria are fairly vague, and many patients without sepsis will have two or more abnormal findings, as in the case of trauma patients. Similarly, there are a number of patients with sepsis who do not have two or more abnormal findings. Some more questions to consider. Have you had the vaccinations you need to take care of patients without getting sick yourself? What are the differences in transmission routes, symptoms, severity of symptoms, prevention, and treatment among hepatitis A, B, and C? What are the symptoms of meningococcal meningitis? What is usual or unusual about the rash? So get the appropriate vaccinations and always use standard precautions, including appropriate use of disposable gloves, eyewear, face protection, and respiratory protection. When assessing patients with an infectious disease, remember to ask them if they have traveled recently. And you also want to ask them if they got the recommended vaccinations. Also, remember to be empathetic and respond appropriately to how the patient feels. Critical thinking. A 2-year-old girl wakes her parents up one night with a very loud cough that sounds like a seal barking. They have never experienced anything like this before and are near panic. How should you deal with this situation? A cough like a seal barking is a characteristic of croup, which tends to get worse at night. Although the volume and the nature of the cough is alarming, you should reassure the parents that the cough isn't as bad as it sounds. Make sure you're taking standard precautions, provide supportive treatment, and assess the child for shortness of breath. Remember that ALS providers may be able to nebulize epinephrine, which may reduce swelling in the airway, and to administer a steroid, which will further reduce that inflammation. So a few patients with croup have enough inflammation and swelling of their airways to be admitted to the hospital, so look for signs of hypoxia.